Okay, I'll start. My name is Laurie Wood-Ducharme. Been with FARHA since 1999. I currently serve as Director of Administration.
Okay.
Hi, my name is Grace McDougall. I started here at Four Arrows in 2001. I started off as a tribal nursing officer, and my current title is Director of Community Health Programs. And I'm one of the few nurses that are here.
Perfect.
Okay, my name is Andy Wood. I've been with Four Arrows since 1999 in different capacities. And right now I'm the Director of the Regional Program. Thank you.
Perfect. Thank you. So I think what we're going to do today then, oh, Alex, I didn't even no. Y'all look behind the masks.
Alex McDougall, Executive Director for Four Arrows Regional Health Authority. I've been with the organization going on 3 years in August, and I've had multiple roles in the Island Lake region, providing various functions to the Island Lake communities. You've all met Stephen. He's our IT specialist and O&M supervisor for the Island Lake communities.
Perfect. Great. Thank you. Well, so we'll kind of move on, and then we'll edit out all my mistakes after. But next, what we'll do is, so I think you have a video, a short video that you wanted to show, right? And then you were going to show a PowerPoint presentation. Is that still the plan?
That has been provided to your IT folks on your end, so they have that. So if they want, they can put it up on the screen.
Perfect.
A group of Manitoba First Nations is implementing rapid COVID-19 testing to screen travelers and essential workers before they're allowed to enter the community. The 4 Island Lake communities of Garden Hill, Red Sucker Lake, St. Theresa Point and Wasagamack have acquired 1,000 rapid tests. This rapid testing initiative was made possible through a partnership between the Four Arrows Regional Health Authority and Indigenous Canadian medical dispensaries.
A lot of times when they have requirements for testing to be done, it can be 3-4 days before that person shows up with a test result saying they were negative. But we don't know what happened in those 3-4 days, and we know that COVID-19, once released into the communities, can become devastating very quickly.
2 digital analyzers are also being installed so COVID results can be obtained quickly. The first batch of rapid tests cost $100,000. Another $300,000 worth of tests have also been secured.
That must have been back in winter when we were dispatching to Red Sucker. Interesting, because I didn't see that.
Okay, perfect.
That was in December.
Okay, so I think we're good to go. And then we've got the PowerPoint, if we can. Thanks, Ron. Okay. So I don't know who was presenting the PowerPoint, but we're running a little bit late, and so it's 2:41 now, so we're probably like 15 or 20 minutes late. So if we can just incorporate that into the timing in the presentation, that'd be great.
Okay, well, I guess I'll make some general comments on the visit and why we're providing this information to the participants. First of all, and who given a Hagwagon March, no, Tansnimon. Can you know, just man than human regionally, Hagway reaching the 4 Arrows Regional Health Authority is in Hategas in Kyank. ego dan una hiwe je mitan khimang da niwan shkunaganan ne umanya rounds ego amaz go get metota mangwe no covid ga thank you to the organizers of the conference for allowing Island Lake Anishininew Nation and its regional health arm, Four Arrows Regional Health Authority, to participate and provide their experience to you dealing with COVID-19 during this past year. On the screen, you'll see a picture of one of our communities with our mission statement. We work every day to try and meet those goals and objectives that we have with three main words that we use to guide our activities, and that's Mamo, Anishininew, Manyang. And you'll see in the wording below, interpreting that is the Island Lake people in wellness together. So that's our mission statement, and I'd just like to very quickly provide a geography lesson. I guess we're located approximately 600 kilometers north, and having a constituency of 4 First Nations communities, Garden Hill First Nation being the biggest, followed by St. Theresa Point First Nation, Wasagamack First Nation, and Red Sucker Lake First Nation. Currently, we are reaching a population of over 15,000 people in a geography that has challenges in accessibility and essential services and goods because of the geography and the location we're at. Our region is only accessible by air and winter roads. That adds to the logistical challenges of providing optimal services for our members. So if we can move, I don't know who's controlling the pages. If we can go to the next PowerPoint slide, please. So some of the points that we'd like to share with the audience is, as I said, our experience working with the pandemic and the outbreak of COVID-19 affecting our region, and the challenges around working with government, working with the leadership, and the other health issues that we see coming up as issues that are adding to the pandemic, like mental health. And I know that staff will speak to that. Okay, next slide. So this is a map of province of Manitoba, and just highlights where Island Lake and the 4 communities are located. Next slide. Some history with Four Arrows. Through the pre-transfer process, working with the 4 Island Lake communities and wanting to improve health services, the communities had found that with the transfer process and some of the 2nd and 3rd level health services made available through transfer, the resources provided were not adequate to meet the needs of our members. And that's where discussions from health directors and leadership found necessary to put together an organization where they would pool these resources and try and work with them as best they can to provide services to their members. Myself, being one of the founding members of Four Arrows Regional Health Authority, so part of that process, along with these folks that are at the table here with me, played critical roles in bringing Four Arrows and the Island Lake communities to where it's at now today. Next slide. This is a path document that was developed by various people in the communities that were involved in health services and some people that were in leadership, basically putting a vision to pen and paper, the ideas of and aspirations of the region and what they'd like to see in the services as far as improving services for our community members. So you'll see that the path has a lot of great ideas, and a lot of those have yet to be brought to fruition. And unfortunately, most of that is not attainable without the support of both governments supporting the visioning and planning of the communities and their tribal regions. Next slide. Okay, this is a picture of an event we had at the Old Post, or Getewakaiganing. It's a historic site where we used to have celebrations marking treaty days and so forth. But this particular date and time in August of 2019, the Island Lake leadership had made a declaration that they wanted to pursue strengthening regional governance, and a result from that assembly was the declaration being signed off by all 4 communities supporting the implementation of a regional grand chief and a grand council for the Island Lake region, or the Island Lake Anishininew Nation territory. Next slide. Present, I guess this is some of the work that we're trying to highlight that's been done or is in the works of being done. We have been wanting to work with the federal and provincial governments to create a hospital in the Island Lake region, or what is described here as a primary healthcare center in the Island Lake area. To date, that hasn't happened, but we have been successful in creating and implementing an interim renal health and dialysis program currently situated in Island Lake. What we hope to do once we do have a hospital or a primary healthcare center located in Island Lake servicing its 15,000 people, that become the primary renal health site, and the interim renal health program be a satellite site supporting our members in Garden Hill and Red Sucker, or wherever the need is needed. Next slide. Looking into the future, I guess that's one of the things that we continue to aspire to attain, is having our own hospital or primary healthcare center in Island Lake. You see a lot of benefits to having a facility in the region, but that is a long ways off with the political environment and the lack of partnering, particularly by the provincial government with First Nations. So that's making it very difficult for us to move that initiative forward. And I can provide some more insight to that as far as our personal experience. Next slide. Okay, this is a public health notice that was recently distributed to the communities after learning of the Manitoba public health orders to restrict further activities in the province of Manitoba and particularly in the city in our efforts to combat or mitigate that transmission and contraction of the virus into the community. We issued a travel directive to the 4 communities, essentially limiting travel to urgent medical appointments and procedures and emergencies and essential service professionals who are listed below, and that anyone returning back to the community is isolated and retested within 7 days of arriving at home. What we're seeing or what we've learned through that process is even though we provide rapid tests here in Winnipeg for travelers going into their communities, with the incubation period, that individual at home may become symptomatic within 7 days and tested and found positive. So we are encouraging members to isolate, self-monitor, and community members to retest those folks within 7 days of arriving. Next slide. This is just a general information on stats for the province of Manitoba and First Nation numbers in its entirety. We do have our own dashboard that has the 4 communities that we track through Health Canada and giving us daily stats on our communities and the number of active cases that we currently see. So we will have seen between the 4 communities a spike in one community or another, and that spike going down in another, and that's been the experience we've seen. And right now, our numbers are the lowest that we've seen, where anywhere between 0 to 7, I think, is the numbers between the 4 communities that are currently having active cases. Next slide. Anyone want to do this one? No? Well, I guess this is just some key messages on the COVID-19 report to First Nation individuals in Manitoba. That's stats that are available for anyone to look at. But as I've been shared through with our communities and our dashboard, we have experienced outbreaks in all of our communities, and I've seen fluctuation in numbers where we would see in the extreme case double digits in number of positive cases, but currently we are seeing the lowest numbers of active cases in our communities to 0 to 7 active cases in any of the 4 communities in Island Lake. Okay, next. This is an awesome picture of our team, our nursing team. We just recently finished doing well, not finished, but continuing to do a urban immunization clinic in Winnipeg for our Island Lake members, and are now opening that to any First Nation Métis member and even members from Ontario to come and get vaccinated at this clinic if they should choose to participate. That option is there for them, and we encourage people to come out and get their vaccine and protect yourself and your families and those around you. Next slide. Some pictures of the area and the activities during our COVID pandemic. You'll see our nurses going into the community, providing support services. You'll also probably have heard of activities where we're sending PPEs out to the communities, providing food hampers to the communities who are Meacham project, even Christmas gifts for the young ones. So we partnered with many of our partners in Winnipeg, wanting to help with the lightening the mood in the community and trying to spare members with their bouts of depression. It's difficult for anybody to be in a lockdown, especially in a small community. We've discouraged using the word lockdown, in fact, for reasons of incidents that have been witnessed in the communities in our region, where there's been spike in attempted suicides and so forth, and even completed suicides. So we do what we can to try and support our community members. And I think our staff will have more to say about that. Greg?
Yeah, the term lockdown for our areas is pretty well a misnomer, because there is no way that we can completely lock down our communities, even though we're trying to keep them safe. Because of the lack of primary healthcare services in all our communities, there's no hospitals. People need to continue to travel to the urban area to access urgent medical care. And even though we know that it's still dangerous for the transmission of this disease, we have no choice. That's just the situation of the geography of our area. Because of the lack of proper primary healthcare services, hospital services, we still need to continue to travel. And even though other communities are able to lock down and not travel, we cannot do that. I just thought I'd add that in.
Okay, we'll go on to the next slide, please. So again, this is a picture of one of our nurses for giving immunization at our week-long urban immunization program. Next. I'll give this one to Grace to give some text to this slide.
I can't really see the slides on the slide. Oh. So we started when COVID first came about. We only started doing the screening for people that were traveling up to the communities. At the request of the leadership in all the 4 communities, they had wanted every passenger to be tested, to be screened before they go up. And when we did this from April to December of 2020. Oh, sorry. So on December 18, we started doing rapid testing. We were able to get access to rapid testing equipment. So we started December 18, and we've been doing this ever since. So it's been a lot of work, but like I said, at the request of the chief and council, they need to be tested before they come to the communities. If we find anybody that's positive, then we refer them to an AIA site where that was just called isolation accommodations. So that's what we were doing ever since, and we're still doing that today. And like a lot of people that traveled during the winter road season, and there was more than probably maybe 150 people a day during that time. So it was really busy.
Yeah, I'll just add to the comments provided by Grace. The illustration you see on the PowerPoint where it says Abbott ID now, that device and those test strips weren't available to Four Arrows or to the other healthcare providers outside of the approval of Health Canada. Health Canada, yes, approved various rapid test systems, but what we've learned is that the preference from Health Canada was that it was Abbott ID Now and Genex that they had supported using in their clinics. And it's only been recently where we have been given access to this Abbott ID test system, rapid test system. Whereas when we had started in December, we had to use what was made available through pharmacy and purchasing through our programs, the BD Verator Plus system, which was something similar to Abbott ID. And we're now working with Health Canada to make that transition from the Verator system to Abbott ID. That there have been challenges working with government, Health Canada, and the province. When we started implementing our plans at the instruction of leadership from the four communities, we had to find innovative ways to get the service to our members. We had to be creative in accessing various resources to make this happen. And without the community's support and their encouragement, this would have been possible. And I think the driver to that was that everybody was genuinely concerned about the health and safety of their members and their communities and wanting to keep it safe. So we went and started looking at what was available to us at the time, and that's what we had was the BD Verator Plus system, and it did what it met our needs at the time. If there was a test that was indicated positive, that triggered our nurses and our staff to refer that individual to an AIA facility where they were isolated and monitored. Yes, some of them came back as false positives. The precaution was taken and additional testing was done, which is essentially what we needed to do to ensure that those people going in were negative. But then again, the incubation period was a concern, and we're only learning and adjusting to those situations as we go. So from the previous slides where we had indicated that through that travel directive, people returning home, self-monitor, self-isolate, and instructed community health personnel there to retest within 7 to 10 days.
So Alex had mentioned some of the challenges that we have with the difference between these two machines. So one of them, the first one that we've been using, we were able to test a few number of people at the same time. And like the first ones were like almost like pregnancy tests, the ones that you get from the store or in the clinic. And you were able to do one person right after the other and be able to, wait for 15 minutes and then just get put the test inside that machine and it'll tell you what it is. So we were able to do a few at a time. And as they were coming in, and they would just have to wait out there. But this one here, the challenge is we can do only one person at a time per machine, and they would have to wait for 15 minutes. So with this one here, the one that we're using, the ID now, is that what it's called? We can only do one person every 15 minutes. So with people coming in, they're used to coming in like maybe 2 hours before, and then they would be able to get on their flight. But this one, the challenge is getting everybody in. Sometimes we do over 50 people a day, and we can only do four testing an hour per machine. So we're thinking about other things on how to get around that. So, and we have to let the people know.
Thank you, Grace. Anybody else have any comments to add to this slide? Okay, next slide. Or is that the last one?
No.
Okay, this is another picture of our staff at our screening and rapid test clinic.
Right across from the airport.
And in the background there, outside the windows, is our partner in the airline services that provides freight and passenger service to all of our 4 communities. So they're just across the street from our clinic, which is very convenient. Next slide. Customer ID, Perimeter Air, along with Transport Canada requirements, I guess, had put into effect this requirement where all travelers had to have identification with them. We've tried working with Perimeter to develop our own forms where there are some people that do not have proper identification. So we have to try and find creative ways to support those members and being able to accommodate their travel back to the community. Yeah, so we've used things like the bracelet that you have from the hospital, even as long as it has the patient's name or the traveler's name on it, that was enough to use as identification. If it came from an institution, I guess one of the takeaways from this process is Perimeter still has a very difficult time identifying 4 Arrows as a professional institution and being able to support a traveler and vouching for that member, confirming that this is who they are, and a lot of them we know personally, and yet Perimeter Airlines with the Income Exchange Corporation has a very difficult time giving that same weight and merit to a First Nation organization and their own autonomy in providing proper identification for its members. Next slide. So this one is some general information on health and safety of our members and encouraging the use of face masks and proper etiquette and your coughing and physical distancing and washing your hands and so forth.
Maybe also I'd like to add that very early on in the pandemic, Four Arrows developed some videos on how to wash hands and also how to wear masks. And we shared these on the social media, Facebook, with our contacts in the Island Lake communities.
Next slide. Again, some more stuff on physical distancing and some general information for folks to look at. Next slide.
The differences between.
Speak up.
We just share resources because in the beginning of the pandemic, a lot of people were unsure of what the COVID symptoms were, and they were confusing like just having a fever and what's common. So this actually really helped in distinguishing what they might have or if it's just a cold.
Thank you for that, Grace. Next slide, please.
Steph here. So we're kind of out of time. I'm gonna ask people. It's going into the health break, and so if people are able to hang around, if you were able to wrap up the presentation, then that would still give us 5 or 10 minutes for questions, just because we were late starting. And then, of course, if people want to leave, they for sure can. Is that okay, Alex?
Yeah, whatever works for you, Stefan. And I do hope that we can make some general comments about the partnership piece and about the mental health piece and so forth. Yeah.
Okay, sounds good.
Yeah.
Next slide. Oh. This is all the supplies that we received for the communities that we've had more supplies coming in ever since COVID started. And we've just divided everything and especially sometimes according to size of the community. So that's what this is.
And that was just one event. We had multiple events like that where we were sending PPEs and various supplies to the community. Yeah.
Next slide.
This is one of our annual assemblies that we have in the communities, and it's done in rotation with our communities. Last year we weren't able to do that, obviously with the outbreak and pandemic. So we are trying to provide information virtually and websites and Facebook. Next slide. Some pictures of people coming through our screening and rapid test program at 18 Ellis Avenue. This is across the street from Perimeter Air. Next slide. This is the naming of the clinic that the Island Lake communities acquired recently to house their screening and rapid test program. And within the coming days here, its pharmacy program. Next slide, please. That's a picture of the front of the clinic, and the name of the clinic, Anishininew Nations. This is jointly owned by the 4 Island Lake communities, and it'll house. It currently houses the screening and rapid test program, and working to kick off its pharmacy and clinic piece shortly. Next slide. There's our picture of Island Lake again, 4 Arrows Regional Health Authority. There is a website that you can visit for more information on our programs and services. The piece I'd like to share before we finish or conclude the virtual conference here is around governance and First Nations governance particular, and its challenges working with Canada and Manitoba. Island Lake, as I've indicated, has a large population of 15,000 people, and has 4 constituent communities that are sharing the same geographical challenges. And the resources that are provided to First Nations programs, health services, and so forth, right now are being all targeted towards combating the pandemic. The disappointment is, at least for me, and I'm hoping that our leadership and other First Nation leadership can take this to Health Canada and Manitoba, is that there are First Nations communities, tribal areas, traditional territories that are under the autonomy of First Nations people, and I say that literally. There are people that think like that. One of them is me, and leaving First Nations people out of decision making where there's health services that impact them directly, I think is something that needs to be revisited by Canada and Manitoba, where policies that directly impact Island Lake should be consulted with directly. Any unilateral decisions made by Canada that impact Island Lake and its members should be taken to the leadership and should be involved in the development of any policies and service and program that are identified for its region. The position that Canada is taking during this pandemic in Manitoba, where it's taking a back seat and giving the helm to the government of Manitoba to take the lead in managing the pandemic, is something that was a surprise to me, and again didn't include First Nations and having them involved in how they would like to respond to the pandemic itself. So I thought I really wanted to share that, and the piece around the pandemic itself and the side effects of that, what we're seeing now with actions of trying to mitigate the transmission of this virus amongst our communities, is now that we're seeing a spike in mental health issues and issues where on the extreme end we're seeing and witnessing completed suicide of our young people, and that is directly attributed to how we're responding to this COVID outbreak, not only in our communities but in Manitoba. And I think that's a big problem that everyone is facing and needs to be addressed. And I know, Andy, you want to add something to that?
Yeah, just very quickly, we keep talking about our 4 First Nations communities, but lately we've been starting to say that we do have a fifth community, and these are people from Island Lake that have had to relocate to urban centers through no choice of their own, but for health reasons, because we don't have a hospital and the primary infrastructure in our community, so they've had to relocate to Winnipeg. So right now we have approximately 3,000 of our Island Lake Anishininew members living in the city. And we need to try and find programs and resources for them while they are living here. And like, again, I want to reiterate that it is no choice of their own that they live here. They're living here because for health reasons or for social reasons, there's no proper housing in the communities. So there is also that fifth community, and we're trying to develop urban programming and resources for these people. Thank you.
I just wanted to say a few things following up on what Andy said about the people living in the city. There was no mention that Four Arrows just recently also bought another facility that we're going to be using for our cultural center. And this came out of a research paper that Andy was working with the province called Living in the City. And basically, they found out that the people moving to the urban centers, were feeling the disconnection, from each other, from the people, from their own families in the community. So, we just bought a facility. We haven't opened it up yet, but it's in the works.
Thank you. How are we doing for time there, Stefan?
I think we're pretty much done. I think maybe we've got, and I'm sorry about this, and thank you. Lots of people are still hanging around. Does anyone have one quick question for folks from Four Arrows here? What I also did is I put on the chat, if people have questions for you, I put down my email, and I'll, of course, will forward them to you. But is there time for, yeah, does anybody have a question that they either want to stick in the chat or that they want to ask? I mean, you brought up, especially the last things, you brought up lots of really important points in terms of the jurisdictional conflicts, as well as the, obviously, as well as the mental health issues. And I think we lose sight of that. And so just wanted to, so I have a quick question for you, and then we'll let people go. In terms of kind of planning for the future, for the next pandemic, what do you see anything change? I mean, I call it institutional amnesia, where it's the same thing over and over again and nothing changes. Are you more hopeful looking forward into the future?
Very much so. I think learning from the SARS and the H1N1 pandemic, and now the COVID pandemic, Island Lake was in the news when the H1N1 outbreak was in the province, where one of our communities asked for assistance from the federal government to help support the communities. And what happened was the federal government, the Manitoba region office here, sent up body bags to help our community. And that wasn't the type of support we were looking for. Was shipments of body bags. Those were sent back to them immediately, by the way. And we've had taken away a lot from the two previous pandemics. We've tried to implement what we've learned from those to this pandemic, and I think we were much better prepared for reacting and providing that support service to our community members. We didn't send up body bags. We provided education and prevention pieces, PPEs. We provided food hampers. We provided gifts for the small ones. Try and take their minds off of the pandemic and being locked up in their homes, and that's something we need to see more of, and I'm hoping that it will alleviate some of the depression that we see and the spike in mental health issues that we're experiencing, not only in our communities but in the province of Manitoba and straight across Canada. That's the biggest learning experiences that we've seen and we've tried to implement, and we continue to learn ourselves. So we're very much a young organization, still very much in its infancy and developing programs and services. Most tribal regional programs are advocacy and consultation services to the communities. So we're now starting to see a small shift in that area where we're now actually providing service oriented programs, and we're very excited about that.
And just very quickly, you mentioned getting ready for the next pandemic. We think we are in the midst of the next pandemic, and we've been saying that for a long time. And that is the mental health pandemic. Yes, and this is something that is coming directly out of COVID for people that have had to isolate, that they can't travel, they can't go anywhere. The overcrowding in our community houses, people, 15, 20 people that are isolating, quarantining in a single house. So, and the children cannot go anywhere. The only thing they can do is go on social media. And this is where some of these suicide pacts are happening. So that we are seeing that, that right now, that is a very urgent matter in our communities, which is the mental health issue. Okay, thank you.
Okay. Thank you, everyone.
If I could, one quick response on that too. Also, Byron Beardy here, food security. Food security is very, very, very issue in our communities, as we are very isolated. Island Lake, 4 isolated communities, we only accessible by air, as you may have noticed. And one of the big shifts that we had within our program, within the food security program, is being an aid service. We've throughout this panic, we provided, as you've seen photos, food aid to our community members. What limited food aid we can, with partnerships with other partnership nationally and provincially, and that's what I wanted to highlight too. That we are. 4 Hours RHA is reaching out for different partnerships for this aid service. When the pandemic hit, we were told all hands on deck, so we had to shift programming to within the food security department anyways as an aid program. So we're still continuing that, not only programming but also aid services. Just wanted to add that to our for our isolated communities. Thank you.
Okay, well, thank you, everyone. That was a fascinating session and a mix of barriers and challenges, especially around the government and jurisdictional challenges, but also you're doing lots of wonderful, wonderful things to support communities. So thank you for sharing. That's it for us. We're done here. We did miss the health break, but I'm sure we'll pick it up in other places along the way. And so, yes, Byron, Jim, Andy, Grace, Lori, and Alex, thank you so much for sharing. Have a great afternoon, everyone.
Okay, thank you.
Okay.
Bye.